Hey, my name's Wesley. I'm going to be your nurse today.
Okay.
I want to close this door just to give you some privacy.
Okay.
Let's see. I'm going to get some hand sanitizer real quick.
Okay.
All right. Please state your name and date of birth for me.
Charles Freeman Shepherd. It's 5/17/1978.
Okay. Awesome. Well, just want to make sure that your room is safe. So it looks like your room is good. It looks like it's free of clutter. I don't see any rugs or towels on the floor, anything that can make you trip. It looks like the room is well lit. It looks like your call light is within reach. You've got your non-skid socks on, I see. Your pathway to the bathroom is clear. And yeah, so everything looks good in here. But anyways, we're gonna go ahead and start your assessments. But before I do, I just wanna ask you, are you experiencing any pain today?
I am.
You are? Okay.
Yeah.
On a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever had, what would you rate your pain at?
A 3.
Alright, so you rate your pain at a 3. Alright. Where's your pain located? What part of your body?
My upper back.
On your upper back? Okay. And how would you describe the pain?
It's like a burning sensation.
Burning sensation?
Yeah.
Alright. How long has this been going on?
3 years.
So about 3 years. And what started the pain? What contributed to it?
Archery.
Archery was the cause of it?
Yeah.
Okay. And is there anything that makes the pain better or makes the pain worse?
Rest.
So rest kind of relieves it?
It does.
Okay. And what about what makes it worse?
Using my arms and my upper shoulders,
Okay.
upper back and shoulders, yeah.
And then as far as this pain goes, how has it affected you in just your everyday life?
It keeps me from doing some things that I like to do. Exercising and stuff like that. Some days I don't get to because of the pain. So.
Okay.
Yeah.
All right. Well, I'm going to go ahead and do your respiratory assessment. So I'm just going to check your respirations.
Okay.
So if you'll just breathe normal for me.
Okay.
Okay.
Ready?
All right. Go ahead. Alright, respirations are 14 breaths per minute.
Okay.
Alright, and now I'm just going to take a listen and listen to your lungs, okay?
Awesome.
So if you'll just take some deep breaths.
Okay.
Okay. Alright, all the lungs and the different lobes of the lungs sound nice and clear. Alright, so it's just real important while you're here that you make sure every few hours that you're turning, make sure that you're taking deep breaths and giving us a really strong cough.
Okay.
That's just going to kind of help everything keep the lungs clear and those airway passages clear. We also have an incentive spirometer. This is something that we use that helps prevent pneumonia. And it's really important to use this when you're awake. You want to use it 10 times per hour just to help prevent pneumonia. The trick with this is to inhale.
Okay.
You're not wanting to blow on this. That's not going to do you any good.
Okay.
You want to inhale.
Okay.
So that's it, and you're just going to
Awesome.
keep that with you. Again, that's just for when you're awake. Okay?
Okay. Thanks.
So I'll set that over here for now.
Okay.
Do you have a cough?
No.
No cough at this
No,
time?
not today.
Okay. And are you experiencing any shortness of breath?
No.
No shortness of breath. Perfect. All right. Well, now we're going to do your cardiac assessment.
Okay.
So first, I'm just going to check your neck for jugular vein distension.
Okay.
So if you'll just kind of look up for me. Okay. And turn your head to this side. Okay. Now JVD. And now I'm going to check your pulses. Okay.
Okay.
So first, I'm going to get your radial pulse.
Okay.
Okay. All right. Pulse was 60 beats per minute.
Okay.
All right. Now let me check your other side.
Okay.
Okay. All right. Now I'm
Feeling
going to
pretty
check.
strong.
Yep, there are 2 plus on both sides. And now I'm going to check your post tip. Okay. All right, that one's also a 2 plus.
Okay.
And now I'm going to check your pedal. Alright, that one's also a 2 plus. Okay, now if you'll stand up for me,
Sure.
we're just going to demonstrate the other places that you can get pulses. So first we have the carotid right here on both sides. And then we have the popliteal pulse, which is behind the knee on both sides. And we have the brachial pulse, which is right here on both sides. We have the femoral, which is right here on both sides. And we have the axillary, which is the armpit on both sides. And now I'm going to check your hands. If you'll have a seat, I'm going to check your hands, and then we're going to check for capillary refill. Alright, capillary refill looks good. And now we're going to check for edema in your arms and legs, okay? Alright, no edema. Now I'm going to listen to your heart sounds, okay?
Okay.
Heart sounds pretty good. Are you having any chest pain today? No chest pain. Alright, that's great. Well, now we're going to move into the next part of this assessment, which is the neurological assessment, okay? So, alright. So if you want to just turn towards me just a little bit more.
Sure.
Alright, so I'm going to first inspect the head and the face for symmetry. Okay, everything looks good and symmetrical. Do you happen to have any headaches often?
No.
No headaches, great. Okay, and now I'm just going to look at your ears and inspect those for symmetry. Okay, everything looks symmetrical with your ears. And now I'm just going to whisper something in your ear, and then just tell me if you can. I'm going to whisper 3 words, and then you tell me if you can know what those are.
Apple, car, school.
Okay, I'm going to do 3 different words.
Okay.
Book, train, blanket.
Book, train, blanket.
Okay. It seems like your hearing's good. Have you had any hearing loss?
I have.
You have had some hearing loss?
Yes.
Okay. Alright, can you tell me about that?
It runs in my family.
Alright, so it's genetic.
But it's not too bad yet.
Okay. And I see that do you wear hearing aids sometimes?
I do.
Okay, awesome. Okay. Alright, and now I'm going to check your eyes. So this is just a light that I'm going to use just to kind of check your pupil's response to light. So, gotta figure out how to work it. Oh, there we go. Okay. So I'm just going to shine in one eye at a time, okay?
Okay.
Okay. Okay. Alright. And it looks like your pupils were reactive to the light, so that's good. Now I'm just going to kind of move this around, and if you'll just kind of follow it with your eyes, okay?
Okay.
Okay. Alright, and let me look one more time just to kind of look at your pupil size. Alright, pupil size is about a 4 right now, 4 millimeters.
Okay.
Okay. Alrighty. When's the last time you had an eye exam?
About 3 months ago.
About 3 months ago?
Yeah.
Okay. Alright, now I'm going to look at your nose.
Okay.
So just kind of, let me see it from both sides.
Okay.
And then kind of up. Okay, the nose is symmetrical. And now I'm going to test your nostril patency. So what I'm going to do is just close one nostril, and I just want you to breathe in through the other one.
Okay.
And we're just making sure that it's clear and that you can breathe, okay?
Okay.
Alright, breathe. Okay, exhale. And breathe through the other one. Alright, the nose is patent. And I have a question for you. Have you had any loss of smell?
I have not.
Okay, so you can smell everything pretty
Yes.
good. Great. Alright, now I'm going to inspect your mouth and your teeth. So if
Okay.
you'll just kind of open up. I'm actually
Okay.
going to use this light just to kind of see inside a little better. Alright, it looks moist and pink like it should. And now I'm just going to kind of look at your teeth.
Okay.
Alright, the teeth everything looks good with the teeth. Okay, now can you swallow for me?
Yeah, sure.
Okay, patient is able to swallow. Alright, now I'm just going to take a look at your neck. I just want to
Okay.
make sure, again, that there's symmetry, the trachea is in the middle, no JDD here, everything looks good. Alright, now have you had any trouble swallowing recently?
I've not.
No trouble. Okay.
No.
Alright. Now I'm going to assess the patient's level of consciousness. So, can you tell me what your name is?
Freeman Shepherd.
Freeman Shepherd, okay?
Yes.
And do you know where we're at right now?
We're at my house.
Okay, you're at your house. And do you know what year it is?
I do. It's 2022.
2022.
Yeah.
And do you know, as far as the situation, what's going on while we're here today?
Yes.
Okay,
Yes. Medical assessment.
medical assessment, that's great.
Yes.
Alright, so patient is alert and oriented times 4. Alright, just kind of want to explain something to you that we use here. It's called the Glasgow Coma Scale. It just evaluates a person's level of consciousness after a brain injury using a point system. But we look for 3 different things. We look for an eye-opening response, we look for a verbal response, and we look for a motor response.
Okay.
And so that's called the Glasgow Coma Scale. So I just wanted to tell you about that today.
Okay.
But thank you so much. That's all.